A vision is not just a picture of what could be. It is an appeal to our better selves, a call to become something more. Rosabeth Moss Cantor. Welcome to MedUnite's very own podcast where we encourage and guide youth into the fascinating universe of medicine. My name is Hannah Strickland, and I will be your host for today's episode. Our guest speaker today is optometrist Dr. Joseph Allen. Dr. Joseph Allen was a Fellow of American Academy of Optometry in 2018. He has a YouTube channel with more than 333,000 subscribers called Dr. Eye Health, educating others about eye health, and an Instagram account named Dr. Eye Health with almost 8,000 followers. He was featured on menshealth.com, National Public Radio, and a Vision Monday article. Without further ado, let's hear from Dr. Joseph Allen about his journey and experiences.
Hello, guys. Thank you so much for the introduction and everything. I'm excited to kind of talk to you guys about who I am, the profession of optometry, and kind of my story of going into this profession. I know for a lot of you, you're probably researching, trying to learn about these different professions, trying to figure out what path you want to kind of travel down, and hopefully kind of learn from other people's mistakes, maybe some of the ones I've done. So right away, just to again introduce myself, my name is Joseph J. Allen. I am a doctor of optometry. I'm also a fellow of the American Academy of Optometry. I'm also a diplomat of the American Board of Optometry. So as I mentioned, I also have a YouTube channel. If we haven't met before, if we have, it's probably because you've seen maybe one of my videos sharing information about eye care, about optometry, whether it be glasses, contacts, surgery, basically all the different products that are out there for eye care. It's really my passion, and I love it so much I decided I'm going to talk about it some more after work and make cool videos all about it. So I can talk about that more if you guys are ever interested. I also share information educating not just general public, but also educating other doctors. There's actually a website called itube.net, not just YouTube, but iTube, which is mainly geared towards surgery, but also I produce videos educating other optometrists on how to do procedures, new kind of technology that's coming out in the profession, as well as kind of tips to improve patient care and overall just kind of dive deeper into optometry. So to start off my story in glasses, I think I got my glasses first when I was about age 6 or 7. And I've always been kind of into technology and whatnot. But I wanted to kind of give you a story arc of who I was as a kid and kind of the steps I took all the way through high school and into college to becoming so passionate about eye care that I even made a costume of a steampunk optometrist for the Renaissance Festival one year. So again, as a young kid, I wore glasses and they were pretty thick. I was also, for a lot of people going into medicine, and maybe some of you maybe will identify with this, but I was very introverted. I read a lot of books. I played a lot of video games. I watched a lot of movies. And especially as a young kid, I really didn't have too many friends. So when I got into junior high, my parents really encouraged me to at least pick a sport, and to hopefully that would get me off the couch, and then maybe I would make some more friends. So I wanted to play football in junior high, in 7th grade, and it's kind of hard to play contact sports like football wearing thick glasses. So my parents went ahead and got me into contact lenses, and it changed my life. And so if you could imagine being a 13-year-old boy, finally getting into contacts, able to play sports, suddenly I'm making friends. From that, I had a boost in self-confidence. And at age 13, I really didn't have anything on my mind other than getting attention from girls in the class. So suddenly I have this self-confidence, and I finally started getting attention from girls. So, growing up, my mother was a dental hygienist, so I spent a lot of time at the dental office. I did not care for my dentist, but I loved seeing my eye doctor. My eye doctor got me contacts, I could see, and it just transformed my life. So I really had a fondness for my eye doctor, my optometrist, who helped me out so much. So finally, when I was probably about where you guys are all at, I was about my junior year of high school. I was in that stressful situation where people start asking you, "Hey, where are you going to go to school? You going to go to college? Are you going to go to college? What are you going to college for? What are you going to be when you're older?" And honestly, that is, if you're in that situation, and you feel stressed from that. I know how you feel. Uh, and I'll be honest, I think figuring out what you want to do with your life is probably 50% of the battle. And it's okay if you don't know what you want to do right now, because I still think it's okay for me to be 32 and still not sure what I want to do right now. You're an ever changing person. Your interests are going to wax and wane. And even in your profession, you may choose one, you may find that it's not exactly what you thought it was going to be. And there's a lot of different ways you can shift gears, change professions. Even one of the famous who I forgot who played Snape in Harry Potter. Maybe you guys know that actor. I think Alan Rickman was his name. He didn't even get into being a actor until his late 40s or early 50s. So you can always change your profession at any time. But yeah, I was in junior year and I was stressed out. I even had a kind of a mental breakdown at that time because I was so stressed over where do I go to school? What am I going to be? What am I going to do with my life? But I ended up going to see my eye doctor around that same time. And again, I loved my eye doctor. I thought he was such a cool guy. But I remember asking him, "Hey, do you like what you do? And what exactly do you do? What does it take to be an optometrist, or wait, what does it take to be an eye doctor?" And he just was very open to me. He spent a few extra minutes talking to me about his journey. And I thought, you know what? I don't know if it's for me, but it could be. It could be something. It could be an option. So that became kind of my compass north for me. So coming up into school, thinking, okay, I'm going to go to college. What courses do I need to take? And I went online and found the closest optometry school to Minnesota, where I practiced, live, and I was growing up. I grew up in St. Cloud, Minnesota. And then I went ahead and found the closest school, which is the Illinois College of Optometry. And I looked up their prerequisites. What kind of courses do I need to get into optometry school? And I basically mapped out my 4-year pre-med degree. Now, I went to the St. John's University. It's also known as St. John's University / College of St. Benedict's. It is a private Catholic university here in Minnesota. But I spent 4 years there, basically on the pre-med track. And I'm sure you guys know, with whatever profession you think you end up going to or want to go to, whether it be optometry, pharmacy, you want to go into podiatry, or if you want to be an MD, you want to do surgery, all those the prerequisites to get into those specialized programs are basically all the same. It's a lot of biology, chemistry, math, physics, some psychology. There's a lot there. So I majored in what was called natural science, which was basically the prerequisites to get into any sort of health degree program. But basically, it was a glorified biology degree. During that time, I shadowed a couple optometrists. I also shadowed a couple ophthalmologists. And that's when I found out that perhaps surgery was not for me. In fact, I went in and shadowed surgery being done, and watching a cataract surgery, if you've never seen that before, it wasn't a big deal. I felt a little woozy in the operating room, being it was my first time in the operating room. I was like, what's going on? They're just trusting this, college / high school kid to just stand here and watch somebody get cut open. And it wasn't bothersome during cataract surgery, but as soon as they did strabismus surgery on a young child, I did see blood, and my body has a hard time dealing with blood. And so I passed out in the operating room, and that was a shadowing. So right away, that was a hint to me that maybe doing eye surgery was not my path. So I found out in eye care, there's two major paths you can go. You can do optometry, which is purely clinic work. That's where you're in the clinic and you're doing a lot of critical thinking. You're managing their care. It's a primary eye care position. Or if you want to do tertiary care and do more surgery, then you have to go the route of ophthalmology. And I can talk about more of that if you guys have questions or interested in those different paths. But at that same time, I knew that, hey, optometry might be my way to go. I applied to a program, which I suggest even you guys could think about if it opens up, how things go with COVID. So I know some people are right now are in the Bay Area. The Berkeley School of Optometry in UC Berkeley does have what's called Opto Camp. And I went to that. I applied for it. And it's basically a 2 or 3 day intensive basically introduction to optometry school. They have you take optometry lessons or courses, and then they teach you what to expect, as well as how to interview, how to take the OAT, how to get into optometry school. They basically coach you through that process. And it was an amazing experience for me. And I would highly suggest that if you are thinking eye care, optometry, look into that program. And it's at least a good way to kind of judge if it's something you really want to invest another 4 years after college into. So I eventually got accepted and went to school in San Antonio, Texas, at the University of Incarnate Word, the Rosenberg School of Optometry. And that's, again, a 4-year program. So you got your pre-med for 4 years, then optometry for 4 years. I think there is one school in the United States that has a 3-year optometry program, but I've only met one person who graduated from it, and that was one of my professors at school, and she's probably one of the smartest people on the planet. So I definitely was not something for me. But certainly 4 years, it's pretty intense, but it's great. You learn a lot of pathology. You learn, of course, all the anatomy, physiology, pathology of the human body. You learn all of the anatomy, pathology of the eyes. You learn all of the different techniques and skills that you need in order to practice to meet the standard of care. And then you have to take all your boards and get all of your experience just to get your degree. Afterward, optometry is different from a lot of other medical professions, such as getting your medical degree, doctor of osteopathy. Residency is optional in optometry, and only about a third of optometrists complete a residency. I did mine through the VA Medical Center here in Minneapolis, which kind of was a primary care subspecialty, but was highly focused around ocular disease, as well as traumatic brain injury rehabilitation and some low vision. So it was a pretty intense residency, and that's where you really learn a lot about your expertise. Because in school, you learn so much, just didactic, you're learning all the textbook stuff, but as soon as you're thrown into the clinic, and you're thrown like the worst cases of, it's not just, oh, this person has cataracts. No, they have cataracts, they've got macular degeneration, they have dry eye, they have a uveitis inflammation that's going on. They have looks like basal cell carcinoma on their eyelid, and their complaint is just that their glasses are sliding down their face. So there's a lot to manage all at once, and that's really where you really learn how to, I think, take care of people in any medical field, and especially is that in residency. Outside of optometry or outside of residency, I went straight into working private practice. But a lot of you may not know that there's different modes of practice for optometry. Like my assistant, or one of my best friends from growing up, she's now my assistant, but she didn't know anything other than optometrists working at Target or a Pearl Vision or Vision Works, whatever the chain stores are. That's all she thought optometrists did. She didn't know that optometrists worked in hospitals. She didn't know that optometrists have private clinics, and she didn't know that optometrists work in research, and they work in industry, helping develop medications, pharmaceuticals, contact lenses. There's a lot of ways you can practice optometry. So since I finished residency, I've primarily worked in private practice. I do not own my own practice. I am instead just an associate doctor. So I'm an employee, or I am a private contractor for private clinics. And this clinic, which I have recently kind of transitioned to, is my kind of dream job. I love that clinic. And they do a lot of specialties in eye care. It's more than just glasses and contacts. They do everything from specialty dry eye to specialty contact lenses. We do LASIK evaluations. We do, again, things like low vision and vision therapy for kids. It's fantastic. I absolutely love it. Now, as an optometrist, a lot of people, well, one of the things I wanted to touch on here today was kind of the responsibilities and the skills required to be an optometrist. And some of you, maybe you've never really had your eyes checked by an eye doctor before. Maybe you've only had your vision checked in school. maybe like a school nurse, and where they have you look at the board and they ask you, read the smallest line. Part of being an optometrist is understanding the optics, understanding the math, the physics of how the eyes work and how our brains see. So a big chunk of your education in optometry school is in optics. You take about 3 semesters of it at the very least. And that covers anything from geometric optics to physiological optics of how the eyes work to just understanding how humans use their eyes and vision. That covers things like color vision and being able to see at nighttime and the extent of human capacity for eyesight. Then, of course, you have the technical component of knowing how to do refraction or finding someone's best visual acuity. This instrument, which is almost synonymous for eye care and optometry, is called a phoropter. And it looks highly technical. I always tell little kids it's like looking through 100 pairs of glasses all at once. They always get so excited when they hear that. Somehow the number 100 is a big deal to little kids. But it always looks kind of complicated. But in fact, once you start understanding how this works, it's pretty simple. And if you ever make it to optometry school, you will cover how to use this device within the first 3-4 months of schooling. And again, optometry school is 4 years, so you can imagine how fast you start learning information. Of course, glasses is a huge part of our profession. Glasses is probably the easiest mode of correcting someone's visual acuity. If somebody has refractive error and they don't see well, glasses is one of the easiest things that can be fast correcting for vision, and has been around since I think the 1600s. Was I think some of the first recorded ever presence of like glasses. So it's pretty cool. But understanding how glasses work, how to prescribe them, how they affect the visual system is a big part of our profession. Another 2 big skill sets for being an optometrist is learning how to use a microscope and understanding the biology of the eye. This microscope is called a slit lamp. And what's so important is that it allows you to see inside the eye up to like 25 to almost 50 times magnification. And you can really see fine details. So if you're somebody who has really good observation, perceptual skills, and I think this is important for any healthcare profession, but for optometry, you really need that good perception. Otherwise, there's a lot of diseases that are pretty easy to miss, even with high magnification. But the other part I wanted to express is being an optometrist, you have to have good communication skills. You have to be able to speak to people. As a surgeon, maybe, if you think you want to go to do surgery, you may not ever have to really talk to patients that much. But if you're, again, an optometrist, it's all about listening and about talking with your patients, being able to educate them on what's going on and helping them through their journey with their eye care. So you do need some skill set of being able to communicate with people. Contact lenses is a cool part of optometry. Not every optometrist will fit contact lenses, but it's something everybody has to learn just to get through school. Soft contact lenses. I've worn soft contacts since I was 13, so it's a big part of my love for the profession. But it goes up far beyond just soft contact lenses. There's a lot of complications with things. So this is under high magnification underneath the contact lens. This kind of buildup on the eye, or what do we call jelly bumps? And it's a buildup of proteins that start to grow or accumulate underneath contact lenses. And this is the big issue when people sleep in their contacts or they don't clean their contact lenses correctly. That can really start to attract bacteria and other microorganisms, which will eat those proteins. And next thing you know, you have an infection on the eye. Another big part of being an optometrist is being able to diagnose as well as treat infections on the eye. So just looking at this gentleman, you could say, oh, maybe it looks like conjunctivitis or a pink eye. Maybe it is. Maybe it's bacteria, but maybe it's virus. Maybe it's a sexual transmitted disease. Maybe that person has a piece of metal stuck underneath their eyelid, and every time they're blinking, it's scratching their eye. So I'm sure Dr. Dunbar has done this with a lot of his animal friends that he sees in his clinic. If they get something on their eye or he has some infection, he'll put a drop of what's called fluorescein sodium on the eye, and that turns the eye kind of a green color. And under a blue fluorescent light, it'll highlight green, and you can see exactly where a scratch is on the eye. So that's pretty cool. I love seeing those cases. So another part of being an optometrist and the responsibilities I have is I do a lot of co-managed surgical care. Now, as an optometrist, depending on what state you live in, if you're living in the United States or what country you live in, you may have different rights for surgery or not. Now, I do a lot of in-office procedures, so things that can be done in the office that don't require anesthesia. I'm not cutting or slicing deep into the eye's tissues where you could get a nasty infection. I'm not doing that. That's saved for the operating room, and that's where my colleague and ophthalmologist, that's their specialty. And they go to school for an additional, I want to say 4 to 5 years at least after there's typical first 4 years of pre-med, then 4 years of medical training. Then they have at least another 4 years of surgical training just for the eyes. But I do a lot of the pre and post work for our surgeon. So our surgeon can keep working and keep seeing more patients in the operating room. So I do a lot of their aftercare. Another big part of being an optometrist, again, goes back to your critical thinking skills, your observation skills, and that's looking inside the eye. And I always thought that was a cool thing about being an eye doctor, is that of all the cranial nerves that you have, the nerves that send to your nose, your ears, your ability to feel, touch, smell, your eyes are the only structure of the body that we can physically see a nerve. We can physically look at it and tell you if it's healthy or if it's diseased or not just by looking at it, and that's the optic nerve. So one of those conditions that we're always checking for, that we diagnose, manage, and treat, is glaucoma. And that's where the nerve slowly dies over time. Usually this occurs with age, but it can happen. Even kids can be born with it. So you can have it at any time in your life. But this is where pressure builds up inside the eye. Well, at least one of the most common form of glaucoma. There's about 65 different types of glaucoma. But this is the most common type, called primary open angle glaucoma, and the pressure inside builds up and that pushes on the nerve, and that nerve is basically dying. That patient would almost be blind from that condition. Other issues are aging related diseases. This is for retina that is now bleeding from a condition called macular degeneration. And then we use some really cool technology now. Back in the day, optometry didn't have access to cool technology like this. This is an OCT. It stands for optical coherence tomography. And it's kind of like getting an ultrasound or an X-ray, but it's of just the retina in the back of the eye. And we're not talking millimeters, which usually if you get an MRI, it takes a millimeter width of a scan, which is really small. But with this instrument, we're getting into microns, and you can see individual layers of the retina. And on the bottom, you can even see basically an accumulation of fluid building up within the retina. And it really helps us identify, understand, diagnose, and treat different diseases. So it's really fascinating and exciting time to be in medicine and eye care. We also identify eye movement disorders, such as having crossed-eyed or what's called strabismus. I know some of you here, just chance, may have either a lazy eye or have some form of a crossed eye. Maybe you had eye surgery when you were a child. So that's something that we identify, manage, and treat. One way is vision therapy, which is a subspecialty of optometry, which is really I do vision therapy with, I have some training in traumatic brain injury rehabilitation, and vision therapy plays a critical role in the rehabilitation after traumatic brain injury or stroke, because it can having any sort of injury like that can significantly affect your ability to focus with your eyes. And so doing vision therapy, you can basically it's like physical therapy. It's like being in PT. You can train your eye muscles and your coordination ability to strengthen those muscles, relieve eye strain, improve focus. And so that's a whole subspecialty of eye care. And then there's scleral lenses, which, again, being a contact lens lover like myself, I do a lot of specialty fits like this. These are specialty lenses that we fit on people who've had diseased eyes. Maybe they had surgery on the eye that didn't go well. Maybe they have a congenital condition and they need these large contact lenses to bathe the eye in solution and keep the eyes moist for severe dry eyes too. That's a whole other subspecialty. This is a condition called keratoconus. Some people are born with this condition where the cornea ends up forming the shape of a cone, it protrudes outward and scars over. And a lot of people end up having to have surgery for this procedure. Random trivia thing, the most common transplanted tissue in the entire human body is cornea. So it's pretty cool. And then, of course, there's low vision. That's a whole other subspecialty of optometry as well. It's not as popular, and I think because of the rise of technology, smartphones, 20 years ago, before smartphones existed, you would basically have the same device for low vision, and it would cost you $2,000 to $4,000. Well, now a lot of people are learning how to use cell phones, and the technology is just built into your standard phone. So still, low vision's a huge subspecialty, and there's a lot of cool things with it, but it's definitely not for everybody. But still a cool thing to consider if you have somebody that you've ever experienced working with that is low vision or is blind of any form. So that's really a big thing with optometry. The last few things I just want to mention is, again, part of my journey. When I was being an optometrist, when I first started working, I realized that my love for optometry, my favorite part of the day was not just prescribing glasses, but was in fact educating my patients about their diseases, educating them, hey, what can you do to prevent getting a disease? Hey, what can you do to see even better? And seeing people change and transform their lives just through talking with them, explaining things. And around that time, I'd watched a cooking show. This is an older cooking show called Good Eats with Alton Brown. And he still makes a lot of cooking shows, but he is kind of famous. He does a lot of scientific explanations in his cooking. He'll break down why milk boils faster than water, and he'll break it down to like the chemical structure. And I always thought that was really cool. And I'm like, gosh, what if there was something like an eye care TV show that broke that down? And I thought, oh, this would be great. I love optometry. So I thought, I'm going to make a public education video series about eye care and eye health and all the products in eye care. It basically became my own TV show that I can share with my own patients. Hey, you have this disease. I want you to learn more. I have several videos on this topic. And also it became available for the public, so people around the world can learn about eye care and how to take care of their eyes. And that became my YouTube channel, which I'm still actively working on. And it takes a lot of work, but it's something that I really love my profession. And I'm very fortunate that we live in this time of age where I get to share my love for my profession and help people around the world with just the technology that's out there. So that is basically my presentation. So if you guys have further questions about the profession, about my journey, or anything that I can explain better, please let me know. I know one of the more common questions I usually get is, funny enough, a lot of people will ask, kind of not just how did I choose a school to go to, whether it be for college or for optometry school. In college, you guys are probably in that state now. I don't think to get into optometry school, it really matters where you go. And I think that's true for most medical schools. It really matters what grades you get and how much work you put into your education. If you go to a state school, you go to an Ivy League, it's all about how much time you put into your education. So you could go to any school and just party your brains out and not learn a thing, or you can choose to hit the library, hit the books, and really learn what you need to and do well in school. And that's ultimately what's going to really shine through to acceptance committees, to getting into things like a medical program or healthcare career. The schools for optometry, at the time when I first applied, there was only about 18 or 19 schools of optometry in the United States. Now I think there's like 20 or 21. I think a few more opened. But to get into optometry school, if you're interested, the acceptance is not as competitive as medical school. You do need at least like a 3.5, 3.6 GPA usually. I think some people can get in if they have a lower GPA, if they have experience, either working in an eye clinic, maybe their scores, the OAT, which is exactly the MCAT, but it's just called the OAT. And that you get a score with. And so if your scores on that are pretty good, your scores overall GPA are pretty good, and you have experience, letters of recommendation, maybe you've shadowed, that is a big factor for getting into a program, into a school.
So what advice would you give to those aiming to pursue a career in optometry?
Yeah. Well, probably biggest thing of advice to anyone who's thinking to get into optometry, probably to really probably niche down to some degree. You'll hear this quite a bit. Some people just go, like I had one friend in optometry school. He already had a job lined up when he went into school. He was an optician working at just a commercial practice, and he already had a job lined up. So as long as he finished the school and got his degree, he had a job where he would basically just be doing glasses and contacts. That's all he would be doing. He wouldn't be doing any medical care at all. He wouldn't treat pink eyes. He wouldn't treat anything, any subspecialty. He wouldn't fit specialty contacts. All he was doing was glasses and contacts. Some doctors love that. Some doctors, that's what they want to do. Myself, I see that career choice going down in the future as technology continues to come out. A lot of commercial practices, Walmart, Walgreens, these places where doctors can sublease or work out of, these companies are trying their best either to, how do I say it? Either politically or technologically remove that position. And they're trying to get it so that they can do a full eye exam remotely with a doctor on the other side of the world. So it's cheaper for like a chain store to like invest in a $200,000 machine that they have a doctor in Egypt do an eye exam remotely through the computer than to pay a doctor in the United States who has a high liability to do all these procedures and to help people. Now, patient satisfaction may go down quite a bit with the way that corporations want to go, but I think for longevity in the career, especially if you want to go into specialty contact lenses or something like vision therapy, then you're a better sell to other doctors or other clinics or hospitals, because if you're working alongside a surgeon and they can only do so much, that's when having expertise in optometry and specialty contact lenses can really come more beneficial. So just thinking long term, where optometry as a profession is going, I think subspecializing is definitely an option and something that I would recommend. And definitely consider doing a residency. But to get to the other questions, is there a difference between a private practice and a private clinic? So I guess yes, to some degree. The big difference would just be private practice is usually owned by one person, or a group practice owned by several people. A private clinic may be more of a multi-specialty clinic. So the private practice I work at is just optometry, but I know some other places that have not just optometry, but they also have doctor of osteopathies working there. There's one in the Twin Cities here in Minnesota that has podiatry, it has primary care, it has dentistry and eye care all under one building. So it's like a one-stop shop for your healthcare. It's pretty cool. But as far as how those practices operate, if you own your own business, you can really do what you want. You can choose what services you want. You can name your price. You basically run how the show goes. It just is a lot more work because it's all resting on your shoulders rather than having somebody else just set everything up and tell you what to do. Your work. So again, I would probably say just talking with my patients, really educating them. I myself identify as an educator. It's my favorite thing to show pictures or show a model of an eye and explain what's going on and help my patient hit that aha moment when they're like, oh, I can just change my diet and my lifestyle, and I can prevent my diabetes in my eye from causing blindness. Maybe I could even reverse my diabetes if I make these changes. So helping people make those realization and those changes in their life, that's really my favorite part. And then of course there comes when you help like a kid who's been struggling in school, and you get them glasses or contacts, and all of a sudden they're seeing 20/20, and they look to their mom, they're like, whoa, that reaction is is really cool. You can always look up, there's always great videos online of like babies who see for the first time or who get glasses for the first time, and they cry and they scream, and then they put glasses on them and they stop for a second and then they start giggling and laughing. It's very empowering. It's very cool. So yeah, that's a good one. How's work-life balance? So that's one of the great pros about being in eye care, especially in optometry. Work-life balance for most optometrists, I say most because I chose to also run a YouTube channel, which is a lot more work than you could imagine. But for most people, work-life balance is excellent because it usually is kind of a 9-to-5 job, or if you are in a commercial practice, it's usually in like a mall setting, so it's usually more like 10 a.m. to 7 p.m. But that gives you your mornings to work on things. In fact, the vast majority of the optometric doctors out there in the United States, majority of them are women now. About 70%, I think, is now women. And one of the great benefits of this is that if you think you may want to have a family, you think you want to have kids, if you're like an accountant, you become an accountant for a firm. Well, if you leave to have kids and you come back a few years later, all of your colleagues that was at that level when you left, they all advanced. And you're now entering back into back where you were, way down the list. For optometry, you can leave the workforce and come back, and you don't lose a placement. You still are like at the same level. And you can even work part-time as an optometrist and still make a decent living. So I know optometrists who only work 2-3 days a week. That still allows them to be with their family or balance with other passions in life. So there's a lot of cool parts to having the work-life balance. Ooh, what is your least favorite part about your work? That is a really powerful question. Every optometrist will be different. So funny enough, my least favorite part is going to be tied between pediatrics. I like working with kids about age 10 and older. I'm just not a kids person. Most of my training is at the VA, which is mostly geriatrics, so I feel more comfortable with geriatrics. It's not that I don't like kids; it's just they scare me. With adults, they give responses I can trust because they have some skin in the game. If they lie to me, if they give me BS answers, they're going to end up with the wrong prescription and things don't go well. With kids, they don't cooperate. They cry. They freak out. They don't even know what eye drops are, and they're screaming about them. I have some doctors that I work with. I work with a pediatric specialist. He loves kids. He does not like seeing adults. We're on the exact opposite. I'd rather see the adults than work with the kids. So it's definitely, it depends on everybody. And then the whole refraction part, better one, better two, it's easy. I think it takes a lot of skill to do it well, but the classic part, better one, better two, some doctors just do that all day. I would lose my mind if I did that all day. I like disease. I like looking at the pathology of the eye and figuring out what the diagnosis is and then treating that disease. That's my fire in my work, not just better one, better two. Okay, here's your glasses. Bye. That's not me. But what education would you need to pursue of subspecialty? Really, for eye care, if you're thinking optometry, once you get into optometry school, you will be at least introduced to those subspecialties of vision therapy, contact lenses, certainly ocular disease. You can do once you get to pick your externships, toward about in the middle of second, third year, you start thinking about your externships of where you're going to go the last year of schooling. You're not even in school. You're technically traveling the country, going to different clinics, getting experience. And you will be able to pick, hey, I want to work in a pediatric clinic, or hey, I want to work in a disease clinic. And so you can get some exposure there. And then, as long as your grades are good in optometry school and your board scores are pretty good, then you just apply to residencies around the country, and then you can really get some subspecialty training. And then finally, what majors do you suggest to start off on if you want to go to the optometry path? So, as far as majors for undergraduate, just like any other healthcare career, it's mostly biology, but you also are going to need chemistry, physics, math, all of those. So, uh, I did natural science, which again was just a glorified biology. I know optometrists who also majored in accounting. I don't know how they majored in accounting and fit all the rest of the sciences in there, but it's certainly possible. I think no matter what health career you choose, again, whether it's optometry, whether you want to go into veterinary school, you want to go medical doctor, whatever, um, look up what school you might want to go to, do a bunch of Google searches, find some schools, look at their prerequisites. Not all schools have the exact same prerequisites, but they're pretty close. Like one school for optometry requires a full 2 semesters of organic chemistry, where some schools only require 1 semester of organic chemistry. But look at those prerequisites, kind of match those up, and then kind of go from there and think, hey, I really love chemistry. I'm going to major in chemistry. Or I really love bio. I'm going to major in bio or do biochemistry. That's another one. So thank you guys so much for, again, inviting me on here. If you guys have more questions, whether it be about eye care in general, about profession, or just anything that I can help with, please always reach out to me, either on Instagram, on YouTube. I'm also on Facebook if you guys use that, or if that's just an old person thing, I don't know. Facebook first came out when I was first getting into college, so that was my generation thing. But so yeah, please reach out, and thank you again.
Thank you all for listening to our second episode on MedAdvice. If you love this episode, please share it with those who have an interest in medicine. Stay tuned for more interesting content, all here on MedAdvice.